Welcome everyone. Again, this is our local government's leader series, and it's on creating healthy public policy. The session today is focused on a collaborative approach to regional social planning services. My name is Jody Muka. I'm pleased to welcome you here this morning. I'm the Executive Director of BC Healthy Communities. I'm originally from a small rural community in southeastern BC, and it's part of the traditional territory of the Ktunaxa Nation. My background's in international development and environmental sustainability, and I've been with BC Healthy Communities since 2005. So again, please feel free to introduce yourself in the chat and include the territory that you're joining us from. So we can move on to the next slide, Yvonne. So I'd like to start our session today by acknowledging that BCHC offices are located on the surrounding traditional land of the Kosapsum and the Lekwungen nations. And we are very thankful to be on these beautiful lands where we live, learn, work, and play today. So next slide. I'll just touch quickly on the agenda today. So I'm going to provide you with a brief background on BC Healthy Communities and our PlanH program, and then also give you a sense of what this Healthy Public Policy series is about. And then I'm going to hand it over to our guest speaker to talk about the collaborative partnership in the Kathit region, and it's focused on regional social planning services. And then the structure of this webinar is that we will have time at the end for questions and answers. So as we go, definitely post any questions you have in the chat. Our staff are monitoring that. And then some of you may have registered for breakout rooms at the beginning when you registered for this webinar. We'll split up into breakout rooms at the end as well. We'll give you a few minutes for a quick break before we go into the breakout rooms, but then there will be the small group discussions within those rooms. And so today we're also live tweeting. If you're on Twitter, feel free to follow along. We are using the hashtag HPP regional. So if you feel like being busy on Twitter, that would be great. And I'll just cover a few other things to note for today. As you may have seen, we are recording this session, and we'll make it available to you on our website shortly after the webinar is complete. The breakout rooms will not be recorded. And in addition, our staff are monitoring the chat box. So if you do have questions, post them in there. They will bring them forward at the end. And all throughout the webinar, they're also posting links to resources for you, which we also will send out as part of the follow-up to this webinar today. Again, if you have any questions, post them in the chat and we'll bring them forward at the end. All right, so if we can go on to the next slide. About BC Healthy Communities. So BC Healthy Communities has been around since 2005. We are a not-for-profit organization, and we are made up of an interdisciplinary team of community planners, public health and community engagement practitioners. And our work is really at the intersection of planning and public health. And the Healthy Communities approach that we use is based on the World Health Organization's approach, and we place equity at the center of everything that we do. So I'll now go on to share a bit about our PlanH program. We've been offering PlanH since 2012, and the program is a partnership between BC Healthy Communities and the Provincial Ministry of Health. And the goal of PlanH overall is to support collaboration between local governments, Indigenous communities, and regional health authorities to advance policies, programs, strategies that are aimed at improving health equity and health and well-being for everyone. And through the PlanH program, we offer capacity building tools and resources. And as a centerpiece to the program, we offer a Healthy Communities grant program. And we are excited to let you know that the intake for applications for our 2 grant streams will be opening on April 1st, and I'll share a little bit more about that at the end of this webinar. But the grant program consists of cash grants as well as BC Healthy Community in-kind capacity supports to you. And PlanH was really designed on the recognition that community policy plans and decisions, they affect everything that we do and the health and the well-being of our communities. So next slide. To set the stage for this really exciting presentation this morning, I'd like to touch on healthy public policy and its role in local governance. So first and foremost, healthy public policy in its simplest form, it's policy that's developed outside of the health sector, and it improves the conditions under which people live, and it positively impacts community health and well-being for all. And it's one of the foundational building blocks of our healthy communities approach, and hence why we focused on supporting healthy public policy through our PlanH program in particular over this past several years. So it's a powerful tool for local and Indigenous governments, and it's a clear pathway for creating systemic change that we need in order to overcome these current complex community challenges that we face. And these are challenges that, I mean, you're all well aware of and are grappling with to address, such as poverty, housing, affordability, and climate change, to name a few. So a little bit about this series in particular. Next slide. So this series, the focus is really to showcase a variety of local and Indigenous government examples of how healthy public policy has been put to action, and the links to improved health outcomes. It's the opportunity to bring leaders and decision makers together to share and learn about best practices across the province. And our aim overall, it's really to help build capacity for healthy communities across the province. So I'll now just speak quickly to social planning at the regional level. So we know that research shows that there's high levels of inequality in a society, and it negatively affects the health of even those who have the highest end of, those on the highest end of the socioeconomic scale. And this is largely due to the impacts of reduced social cohesion. So even though we know this, we often do still plan in silos. And we really do need to keep in mind that the several of the social determinants of health, such as income, social status, childhood experiences, and housing, are all factors that they extend beyond our own jurisdictions. And we need to take a broader view and incorporate a systemic way of thinking, systems thinking, if we want to impact the health and well-being of our communities and have communities that are equitable for all. And while regional planning, it's not a new concept, applying a regional approach to social planning, it allows us to bring together human resources, a shared political commitment, and even the financial means and resources together so that we can address taking action on the determinants of health. And overall, it provides greater opportunity for creating healthy, thriving, resilient communities for all. So now this is a very exciting part of this webinar where I get to introduce our amazing speaker today. So without further ado, I would like to introduce you to Meriko Kubota. She is a regional social planner representing a collaborative planning position between 3 partners, which includes the City of Powell River, Cathet Regional District, and the Salaaman Nation. So Meriko has spent the past 3 years in this exciting position and focused on building healthy communities in the Cathet region. And prior to her role as social planner, she spent a decade in community building through a variety of really cool roles. I think you've done some amazing jobs, including consulting in organizational development as the Director of Sponsorship, Marketing, and Community Investment for Mountain Equipment Co-op, as the Director of Strategic Partnerships and Community Investments for TELUS, and lastly, but not least, as Manager of Grants and Special Projects for the Vancouver Foundation. Meriko's experience has given her a balanced understanding of both the complex social challenges in the Catholic region, and this includes issues such as affordable housing, poverty reduction, early years, and social cohesion. She also brings some experience and forward thinking around the kinds of strategies that these communities can take to address those complex challenges. So I will now hand it over to Meriko Kubota to speak about regional social planning services in the Catholic region. Over to you, Meriko.
Thank you, Jody. Thank you so much for such a warm introduction and for having me be part of this speaker series. And I really want to thank everyone who has shown up and is online with us this morning. I really appreciate you taking the time out of your day and joining us. And I hope that what I have to share with you will be of interest and it will create a dialogue. And I really hope that, that the sharing will spark some opportunities for connection. So as Jody said, my name is Meriko Kubota, and I am the Regional Social Planner for the Cothet region. And I would like to acknowledge that I am speaking to you from the traditional territory of the Klahaman Nation. And today I'm pleased to share with you the regional social planning model that we have, which is supported by our 3 local governments, the City of Powell River, the Cothet Regional District, and Klahaman Nation. Yvonne, I'll ask you to switch to the next slide for me, please. So in order to share with you about the regional social planning model, I will explain for you where the idea for a regional social planner came from, how the idea was championed and supported, how the position itself is funded, how regional social planning works, and what we have learned that will be possibly useful for other regions who may also be interested in establishing regional social planning. Next slide, please. I think it's important for me to help you situate where our region is, and we are located on the west coast of BC. We're on the traditional territory of the Klahaman, Shishal, Klahoos, Homolko, and Comox First Nation. And our region represents land here that also includes some islands, including Savory, Texada, and Liskidi Islands. We are only accessible by ferry or plane, at least 1 ferry, if not 2. And I mention this because it's really important to highlight just how rural we are and how intentional our community is, because there's no other city or suburb that we can kind of access immediately. And our region incorporates 5 electoral areas, which includes the City of Powell River, and we serve a population of over 20,000 people. Next slide, please. And as I've mentioned, we are on the traditional territory of the Klahaman Nation, and I want to share with you how this nation underwent self-governing processes that took over 20 years of negotiation. This was signed on in 2014 and came into effect in 2016. So the Klahaman Final Agreement Act provides the nation with constitutionally protected self-government provisions. And this is really important when we're thinking about social issues like access to housing, because the nation itself and its members are transitioning from a colonial model to now self-managing their housing, including having nation members challenged with learning about mortgages, and as housing stocks are renovated and rent prices are transitioning to market levels. Next slide, please. I think before I get into the details about how we became regional in social planning, it's important to demonstrate the foundation that was established in our community. And this is a copy of our community accord. Essentially, we have a document called Pathways to Collaboration, which really demonstrates our history of collaboration and some of the agreements that came into place to help support this collaboration. And it's a really fascinating story, but back in 2002, essentially the City of Powell River was trying to build a seawalk on our waterfront. And the Klahaman Nation came up to the city and said, "What are you doing? why are you doing this? You haven't communicated to us how you're building a seawalk on very important archaeological ground in our territory. So the project stalled at that point, and a communication occurred, and then a collaboration was born to work on establishing the seawalk together. And as a resident who lives here, I think this is really beautiful because I can actually see where the project was initiated by the city, and then the nation joined in, because the seawalk from where the nation joined in actually has stairs that take us down to the waterway. And I think it's really symbolic of the collaboration and the project that that came underway. In addition to this community accord between the city and Kahama Nation. Kahama Nation gifted to the regional district the name Kothet, which means working together. So in 2018, the regional district name changed from Powell River Regional District to the Kothet Regional District, hence why you'll hear me speak to our region as the Kothet region. We now at this time have a 3Cs forum in which all of our 3 governments meet on a regular basis. So that's our community to community to community forum, and our 3 CAOs meet on a monthly basis as well. And it's really this history of collaboration that brings us to the community-led and government-championed efforts towards regional social planning. So next slide, please. And everything starts at the community level. And in 2014, a community conference called the Groundswell was held at the Vancouver Island University in Powell River. And the event brought over 160 community members to essentially talk about community issues. And this report culminated in over 100 recommendations. It's from this work that then the 3 governments decided to engage with a local consultant and collaborate with Vancouver Coastal Health to then establish a further consultation process and report that essentially has provided us with our social planning program that had the recommendation to hire a social planner for the region. And the role is funded by all 3 governments per population base. And this was endorsed in 2019. So my role came into effect in 2019, and I came into this role that was net new at the time. Next slide, please. Another important component of the work that was done to establish regional social planning was establishing the governance structure. And so you'll see that this diagram demonstrates how the regional social planner does funnel into all 3 governments, but it also has a committee that is called the Social Action and Planning Advisory Committee. And it's made up of 2 representatives from each local government, as well as the 3 CAOs, and also the Vancouver Coastal Health Chief Medical Officer and the school district superintendent. So really fantastic community-led and regional committee that supports the work of regional social planning. And then from there, next slide, please. We had 4 top priorities that were defined in the social planning program. And they are suitable, sustainable housing for all people, healthy early childhood development for all children, social cohesion throughout the region, and poverty alleviation and reduced income disparity. That's not to say that other social issues are not present. They often fall under some of these priority areas, but it really helps to define where to start. And in the next slide, you'll see that essentially this has developed our framework. So goals, objectives, and actions identified for each of these areas, as well as an additional area which really focuses on planning, research, and services as well. And I think this work plan is really important because you may feel this way yourselves, and or community members that you work with may feel this way, that it's not clear what social planning is necessarily and or what it will work on. And so this governance structure and the framework really help to clarify this further. Next slide, please. I'm really pleased to share with you that we already have a progress report that is available on our websites. And essentially, we've been able to make some progress over 2019 and 2020 that really helped to at least create a baseline and further communicate what regional social planning is. And at this point, I really want to acknowledge my colleague, Kai Okazaki, who covered my maternity leave in 2020 and 2021. because I went on maternity leave, and he's now the social planner for City of Burnaby. And he really covered my mat leave predominantly through the pandemic. And I've returned as of August of last year. So things have changed. And what I'm really hoping to share with you are some details about our planning work that may be of interest to you. So next slide, please. At this point, I just really want to acknowledge that social planning doesn't work without community members. It's the members, it's the community organizations, it's the government staff, it's the government elected officials who all are working in tandem on all of these social issues. When I started in 2019, there was incredible momentum on all of these areas, and we've been so fortunate that over the last couple of years, we've seen provincial funding through UBCM for a number of critical social issues. However, I do want to highlight where we're at to date. And so next slide, please. And it's important to acknowledge the pandemic and the results of it, and also where we're at in what I hope to say is our current sort of transition out of the pandemic stage right now. But I'm sure that you, like me, will notice such an increase in mental health issues across your community, and how this affects your colleagues, your friends, your family, and burnout on the front line for the nonprofit organizations that are doing a lot of the social service work itself. And another big important aspect is really taking it to note and recognizing that there seems to be real division in trust and connection. And that's on all matters, but on social matters, sometimes they can become quite exacerbated. And so again, I really want to highlight that planning right now is not picking up from where we were at in 2019, but it's restarting and really taking some time to go slow in order to build up in our community. So it's just really important also to acknowledge some folks who've really been impacted. And when it comes to social planning, I'm really keeping our seniors top of mind as we are coming out of 2 years of deep isolation for our seniors and deep fear of their health and well-being. There is, of course, as I've mentioned, a bit of loss of momentum, but I think it's really important that we take stock of where we are right now and really consider the community snapshot to date to be our starting point, and not start from where we were in programming previously. And on a really positive note, the pandemic has offered us new tools, including our ability to meet online. And I've never seen so many youth and such a diversity of participants come to community conversations like I have had seen with online meetings, because of the accessibility and the inclusivity that it really supports and creates space for. So let's dive into the categories of the 4 focus areas in our social planning in the Cothat region. And I'll start with housing first. All of us have now completed our housing needs assessment. And you might ask, well, why is the social planner involved? And essentially, it really, I think, exemplifies what a social planner can really do, which is to facilitate and convene and bring together. And so I played a role to facilitate and initiate a working group across our 3 governments, endorsed by our 3 CAOs. And this really has set a precedent to think about housing for us in a regional perspective. As I mentioned to you, our geography already kind of defines that there's no other next community to go to. So if you're, as a resident seeking housing, you're going to leave our region. You're not going to stay within your region, so within the region. So in order to think about housing as the region, it's really important to work across our 3 governments. This cross collaboration was not just across the planning and housing teams and even engineering, but also intersects with other departments, including fire and rescue, RCMP, and bylaw, because housing shortages have put so much pressure on the lives of our residents. And we are all seeing the effects of either overhoused and isolated, or unhoused and everything between. And as the social planner, I convene and manage ongoing community meetings with our nonprofit housing providers to share and discuss our opportunities. And we're also recently hosting workshops for developers and investors to seek out opportunities for their engagement in developing affordable housing. So again, it's all these touch points that I, as the regional social planner, am able to help to connect dots on. And it's really leveraging our community momentum in our region that allows us to know where are we going. And so currently we have 2 nonprofit housing providers ready to initiate their next housing project. We even have a local credit union willing to be involved in perhaps the establishment of co-op housing in our community. And it's about listening and connecting these dots and facilitating the opportunities in order for us to help make progress in housing in our region overall. So I hope that gives you a sense of housing, and we'll go on to early years next. And I just want to take a pause to say thank you to any of you who may work in early years. It's a very challenging system. And from a local government level, for me, it's a constant challenge to ask myself, what is our role in local government around early years? But I just want to highlight the system overall and then what we're doing within it. So early childhood educators are highly educated professionals and teachers, yet they're not always recognized and valued in that way. Their low wages, in fact, reflect this. And we as a rural community are further challenged to help and support this sector because we don't have a local university for providing the education and the practicum opportunities. And so we essentially lose through a brain drain a lot of our early childhood educators who go and get trained on the lower mainland or on the island and end up working and having their practicums and working and then gaining jobs where they've been trained. I think also what's been challenging is the connection between the early years with the school age years. And so this will be really interesting to see as a transition as we see the movement from the Ministry of Family and Children Development to the Ministry of Education. I want to share with you that in our region, it's really interesting that our early years planning table, which is made up of all the people who work in early years, is the longest standing community led network that has maintained themselves over the years and continue to meet. And I think it just really demonstrates the level of passion and dedication in this sector. But I'm really grateful to this group also because from a social planning perspective, they really worked with HELP at UBC, the Human Early Learning Partnership, to ensure that we were one of the earliest pilot communities for the EDI and TDIs, the Early Development Instrument and the Toddler Development Instrument. And you can imagine that in social planning, the data, the information we've been collecting on our early years is profoundly important, especially as we also are aware that our child poverty rates are really high in our region. And so the early years planning tables really stewarded this area extremely well. And we're really excited to now be establishing an early years educator network that is inclusive of all types of childcare, from licensed to family daycare. And essentially we're bringing together all the workers so that we can really work at the grassroots level around sharing and learning, establishing mentorship opportunities within the network. And this has become really important as we come out of the pandemic because there have been some early years workers who've been trained online, but haven't had a lot of opportunity to work on the ground. We also really take it to heart as a rural community that ECEs have had to go and get their continued education offsite and have to travel for that and pay for that themselves. But now a lot of those opportunities are aligned and online, and we can coordinate those for our region. Obviously a space for sharing opportunities and challenges, but also really important from a local government level to have a advocacy voice. And so this network is creating the advocacy voice so that from the local government, I can help support the advocacy to the provincial and to the federal governments as well. As I mentioned, the change in ministries is, I think, really phenomenal, and we'll see how this all transforms for all of us. But I think what's really exciting is for early childhood educators to really be seen as teachers and educators and not as babysitters any longer. And ultimately, for all of us in our communities to be able to have greater choice for our families overall, and to not be stuck on the demands of wait lists in order to find spaces for our children. So that's early years, and we'll go on to poverty reduction next. This can be a very unruly and big area, and I think it's really important to note that, of course, poverty encompasses so many important topics, including early years and housing and transportation. But I want to share with you that our poverty reduction approach, I think, was quite progressive in our community, because the project team itself started off as a multi-sectoral partnership of a nonprofit organization, a credit union, and regional social planning. And this dynamic of this team, I think, uniquely created the opportunity for a diverse advisory committee that also then included different sectors as well as individuals with lived experience. And it's in this space that we were able to talk about all the issues that fall under poverty, including income, housing, childcare, transportation, food access, etc. And of course, we were, as many other communities, seeking advice and partnership from the Tamarack Institute, who provided a number of tools and resources and supports to us as well. But what did we learn from this? And the data is really important, is that there are three priority focus areas for us, and they are seniors, lone parents, and the working poor. At one point, I believe we were the second oldest community in BC, and the stats show that our region is on average 11.1 years older than other BC communities. And also important to note, our community earns $8,100 less than other people in BC as well. Our child poverty rate, which I had mentioned earlier, is high. And so the data is actually that we're 6% higher than the provincial average. And I just want to share an anecdotal example that one of our nonprofit housing providers just recently opened up a new housing project. And through their intake process, they learned that on average, the residents that they were approving into the building were paying on average more than 52% of their income. And these are people who are working. So this really, I think, paints the picture of the working poor and what that means in terms of the level of their income they're spending on their housing. The data that we've collected on all these areas are really important. And so we're taking some efforts right now to try to input the data into a software program called Tableau, which we hope that we'll be able to pull in social planning very easily, but also offer up to our community members so that they can use it in their programming, as well as communicating their work and even applying for grants. The poverty reduction report, of course, for us has established and helped with short-term and long-term planning priorities. And one topic that I think is sometimes overlooked under poverty is a connection to social procurement. And I'm really thrilled that at the City of Powell River, we have now included a social procurement policy, and we'll be working on one for the regional district as well. And these social procurement practices really help us to further the social and environmental benefits to our local economy. The fourth priority area is social cohesion, and it's not last and least, but it's actually the foundation for so many of the other social issues that I've touched on. And when in 2019, we were speaking about social cohesion, it was a lot about public events, engagement, social and physical infrastructure, and facilitating social connections. And my goodness, the pandemic has really highlighted how important social cohesion is. And again, a real gratitude to Kai Okazaki, who covered my mat leave during the pandemic, because it became very clear that social planning plays a critical role in supporting the emergency response centers and really identifying, with the support of many organizations, our most at-risk and vulnerable populations in our community. You may also have heard in the news probably that our mill has closed, and this has impacted 200 workers and their families. So this is very important in social planning, as we've provided further mental health supports, job transition supports, and not only for the worker themselves, but for their family members, because this really does have a ripple effect throughout our community. it's really top of mind for me to make sure that our seniors programming comes up and running as soon as possible, and that we can get some of the earlier adopters to show that it's safe and or that there's a level of comfort that people can seek in order for us to get people out of isolation as much as possible, because our population is very high with the demographic of seniors. So they're very important and critical and also very active demographic in our community. And what we've learned from our poverty report that I think is really interesting as a rural and smaller community is that regardless of your income, your social cohesion, your access to friends, family, your social network, and your ability to rely on others to support you in times of need are going to be an indicator of whether or not you are thriving and being able to live a really healthy and well life. So social cohesion, I can't speak about enough, because this is just so important and critical to all the work we do in social planning. And finally, the final area, Yvonne, to the next slide, please, is our planning, research, and services. And as I mentioned earlier, the data we collect and sharing that is a part of what's important. I'm really mindful that I am a staffed person and not a social planning council. And so social planning councils do a really good job of this. And because I'm just on my own, the planning, research, and services work is still really critical in ensuring that I am sharing out all the information that I am essentially collecting, and that I am facilitating the connecting of dots, but that others are able to do that themselves as well. So finally, in this last slide for you, I have wanted to share some learnings and some takeaways and some, I think, opportunities for you to consider that we've really experienced in social planning so far. It really is community driven and in partnership between local government and community. It really doesn't happen unless there is momentum in the community and that the community is driven. And I think that's really relevant from a government level, because when social planning became a regional service, the regional district did need to include a new bylaw around social planning. So again, the community support is critical. The inclusion of a diversity of stakeholders to identify holistic issues and concerns. I think this was very evident in the establishment of social planning, so that the 4 priority areas could be identified. And I really appreciate the leadership and, for example, noting early years and social cohesion, for example. But also in the poverty reduction work that we've done, it's been really important for us to be able to say the data and the income stats look like this, but what's the evidence? And the evidence really comes out from the lived experiences that people have. And then sorry, I just had to remove the chat here so I could see the slide. We are able to leverage our combined funding contributions by being regional. And so I have to admit that I have sought out the most amount of money I can from grants by really demonstrating that we are working as a region and we're not doing this in siloed work. And therefore, we're not having to repeat the work from one government to the next in a region as well. The definition of a work plan and governance structure has been very important, as I said, especially from a communication standpoint. I laugh because a lot of people ask me what I am or what I do, and the title social planning is not always obvious and understood. So a lot of people think that I plan parties and events, and I would highly recommend that you don't hire me for that, because that's not my skill set. But again, that communication is really important, and I think the governance structure can look different from one place to another, but just having one to ensure that there's support and structure is really important. There are always ongoing challenges in resourcing, both human resources and budget. You know, there's these 4 priorities areas that I've highlighted for you, but with the mill closing, for example, there's just so many things that just happen in community on an ongoing basis, as we all know and see on a regular basis. And I think it's really great that the social planning role is quite independent and yet interconnected, because this allows for relationships to be built across. And really nothing happens without relationships. So I'll just go to my last slide, which is to share with you my email address in case you're interested in further connecting with me. I want to really at this point just thank all the people that are involved in social planning. I really feel honored in this role that although I am hired by the 3 local governments, I really play a role of serving the community and the community members and what they're prioritizing, where they're wanting to go. And so again, I want to highlight that facilitation role that I'm playing. I'm not really accomplishing and doing the work itself. It's really the individuals who are making that happen. And I also want to highlight that social planning, what's really important is to maintain neutrality and the ability to convene. And this takes me back to my days of working at the Vancouver Foundation. And it's such a privileged space to work in when you get to be a very neutral agent that everyone feels that you are there to support, and therefore you're able to bring all the players together. So naturally, there's lots of opportunities to convene, sometimes mediate, build relationships, foster connections, and that ultimately helps with the organizational structures that result in the programming and the work that gets done on the ground in the community. So with that, I just really want to thank you for taking the time to listen to me, for my opportunity to share with you this information. I hope it's of interest. There's so much work to do in this area, and so I'm ever busy and continuing, but I am always seeking out great ideas as well. So I welcome them through this network of individuals who've clearly been interested in social planning and attended the session today. So thank you, and I'll pass it back to Jody.
Thank you so much, Meriko. You have a cool job, very cool. And I love your enthusiasm. So thank you. Thank you so much for presenting today. And one of the things that really stood out for me at the end, my mom is in a small rural community, and it really stood out to me in terms of what you were talking about, the importance of social cohesion for older adults. I mean, I'm seeing this issue personally with my mom in a small rural community, and the impacts that COVID has had on her this past 2 years. So yeah, that was kind of a tugged at my heartstrings a little bit there. So thank you for this very informative and engaging presentation today. And I also really appreciated this historical overview that you provided us with in terms of how it came to be that the three local governments came into this partnership and hired you in this very amazing collaborative position. So thank you for that. It's really a good demonstration of working together and an excellent example, I think, of healthy communities, the healthy communities approach in action, which really consists of 5 elements, and that includes community engagement, asset-based community development, public policy, healthy public policy, that multi-sectoral collaboration, and the political commitment. And you really demonstrate that there was political commitment on the behalf of 3 local governments to come together for this. And I'm sure, as you said, it's not always that easy, but really the key messages that you've certainly illustrated today are that the social determinants of health, they are cross-jurisdictional. And by taking a regional approach, it allows us to recognize the interdependencies and help us together build resilience and resiliency within and across our communities. And then you, in your role, and regional planners in that role, have the opportunity and do provide facilitation, convening services, and really connecting the dots across partners, across sectors, and across these different complex community issues that we're all grappling with. And really, the best way to move forward is together, and that is the opportunity to make our communities healthier and ultimately individuals within the community healthier as well. So we could just go to the next slide. So, and just a bit of a wrap up, as we've heard today, taking a regional approach really does require multiple concurrent responses and creative solutions. It does really require that we go above and beyond what we already know. and take new actions and apply new tools and new approaches, and look at different ways of planning in our communities and collaborating. And some examples of mechanisms that can support this are things such as mutual aid agreements, partnership agreements and MOUs, social planning councils, community health networks, and membership on social planning and action tables. So we can go to the next slide. Just wrapping up with these last slides here. So you can learn more about healthy public policy by visiting our PlanH website at planh.ca. You are more than welcome to reach out to our BCHC staff, and they'll be happy to share capacity building tools, resources with you on a variety of topics, including land use, social planning, equitable community engagement, local economic development, and active transportation. So do reach out. We'll provide our contact info at the end. There's also some really great online resources that you can access through the National Collaborating Center for Healthy Public Policy. And one in particular is the framework for analyzing public policy. So you can go to that website. We'll send that link out as well. And I mentioned at the beginning, the other thing you can do is apply for healthy public policy grants. We will be opening the intake on April 1st, so very excited about that. We're offering 2 streams. One stream is for healthy public policy, and the other is community connectedness. So it's now 11:48, and we will take the next several minutes to answer any questions that you may have posted in the chat. So, and then after that, I'm just going to flag again that our discussion groups in the breakout rooms will begin at noon. So if you do need to take a quick break right now, you might want to get up and stretch, top up your coffee, grab a glass of water, and then come back for the breakout rooms for noon. So I will now see what we have for questions. If anyone, let me just check my chat here. I am not sure, team, how I am taking the questions.
I can
jump in here. Okay.
Yeah, wonderful. I can jump in here and help you.
Thank you,
Jody. No problem. So we've had amazing response. Thank you so much. And thanks to our behind the scenes team for pulling all these questions together. We have about 10 minutes to do the best we can to answer as many questions. So Jody, for Meriko, the first question is, keeps moving here. Do you have KPIs for poverty reduction? There's 2 parts. Is this a relative concept or absolute in terms of inequality?
Yes.
Meriko? Yeah.
So first of all, I definitely want to share that we have our regional poverty reduction report available online on our City of Powell River website. And so anyone who's interested in that can feel free to seek that out. And we have had initial discussions about measurements, but not firmed those up, as the strategy was providing a number of recommendations of where to go. But then we needed to work as a community to establish our coordination to then work on where are we going next. And so the KPIs are always such an interesting question when it comes to community work. Because it is challenging and yet very important. And so we have not yet completely established our KPI specific to our poverty reduction report, but I think that we will for the measures that we can, and yet at the same time, we will be working on the communication piece that was really highlighted as part of the work from the advisory committee process, where yes, we want KPIs. Yes, we want metrics to be following both qualitative and quantitative. But what's really important is that we as a community are coordinated and connecting with one another on an ongoing basis, like this advisory committee has had an opportunity to do so, and to be able to communicate back to our local governments and our stakeholders across the region to share the experiences of our residents in the community. And so that sort of hard data with the I think the experience and the lived experience examples shared across the region. So I hope that answers that question.
Yeah, thanks, Meriko. Have another one coming your way here.
Okay.
Here, ready? Okay. Wondering if it's possible to elaborate a little bit more on social procurement practices. You had talked about them in your presentation.
Sure, that's a big question. I won't go into the sort of like dictionary definition of social procurement, and I think that there's such really good resources for social procurement. But in Cole's notes, I just want to highlight that especially at the local government level, we have opportunities to procure on an ongoing basis for various types of projects. For example, most recently, our biggest project in town has been our wastewater treatment plant that's being replaced. And so now with a social procurement policy lens, what that is adding on is a social and environmental lens to the procurement. And so where are we seeking opportunities to seek local, most impactful, most inclusive and accessible opportunities to retain, whether it's contractors, products and services, so that we can be thinking about really the supply chain and where we're sourcing from overall. And so this really does touch on poverty, because if we can be thinking more local, if we can be thinking more accessible, that means and inclusive, it means that then we are hiring more, we are offering opportunities for more work, and also servicing from local businesses as best as possible as well.
Great, thank you very much. And I see Abby's replied to someone in the chat. Yes, you definitely can join the breakout room. If you haven't signed up for it, just hang on when we finish up the question period, and then you'll get assigned to a room, no problem. All right, so another question for you, Meriko. Is it possible to be neutral in the face of poverty and inequality?
Great question.
Yeah.
Yes, it's like one of those like sort of like, okay, but it's not obvious. Okay, yeah. So I think what's important is, you know, you as I presented, there's the 4 priority areas. So the stance already in social planning is that we want to lift more and more people up in all those areas. So indeed, that is not neutral. The position is that, of course, we want to lift everybody up. But what I want to highlight from the neutrality perspective is that we're not taking the position of any particular operator, nonprofit organization, department of the city. That's really where it comes. It's the neutrality is in the relations management and the community engagement processes. So less about the topic itself. So of course, from a social planning perspective, we are advocating for, and we want to see improvements in all of those social areas. But it's the how do we facilitate and how do we bring people in? So I need to be able to work with fire and rescue. I need to be able to work with our lead non-for-profits on the front lines. I need to be able to work with developers. And so it's the relationship management piece that I was highlighting in the opportunity to stay neutral.
Okay, great. Thank you. And you touched on this one, Meriko, as well, just in terms of how you work and working on your own or with other staff. But one of the questions was, do you work alone? Or are you able to hire other staff to support the social planning role?
Yeah, so far in our region, there's just me, supported by the 3 governments. However, we have been very fortunate with our Strengthening Community Services grant, which we applied to through UBCM. We were successful for that. And with that, right now, we have a social planning assistant, Ashley Van Zwietering, who's part of our team at the time, and at this time during the duration of that project. So unfortunately, from an ongoing full-time headcount perspective, it's just me at this time. But I work when you say team, I definitely don't work alone. My schedule is always meeting with and connecting with everybody. And so I am placed within the planning department at the city. But as I said, I work for all 3 governments. And so my colleagues are basically everyone.
That's great. Thank you. So that kind of leads into the next one, and working on your own and across areas as you do you also work with communities outside but adjacent to the Quathut region?
Oh, well, I think we do, in the sense that we're always sharing and learning. So the Lower Sunshine Coast, for example, a perfect example is that they've had a well-established seniors planning table, I believe is what it's called. And so they've shared all, what they can with me so that we can try to establish one here. I'm part of the Vancouver Island Social Planners have welcomed me into their fold, even though I'm on the Sunshine Coast. And so I meet with them as the Social Planners Network. And I've been connecting in further with the city of Kamloops on various issues related to social planning, even though their team members are not called social planners. So I don't work with other communities on specific projects in planning, but it's the constant learning and sharing and connecting and knowing what's happening in other communities that is relevant to us. That's really important. And so that very much is a part of my work and ongoing. And I find that mutual relationship really, really valuable for all of our work. And I think it's been really valuable to note that social issues and just what we are observing around social planning issues are quite similar across communities in BC, but then also there are some unique and challenging things when it comes to being rural versus urban, etc. So it's nice to share and to connect with other communities.
That's great, thank you. And just have a couple more minutes, and one other question here. What is ECDM? It's one of our audience questions. So probably what is that? And then what does that stand for? ECDM?
I think I might need a clarification on, I don't know if ECDM came from one of my slides. I don't think so. So I'm not too sure. Oh, UBCM?
Oh, UBCM. Sorry, it was a typo. Yeah.
Okay,
sorry.
thank you.
Thank you for the clarification in the chat.
Great
box.
question.
Much appreciated.
Union of BC Municipalities. So it's the Union of BC Municipalities that that supports all of our municipalities and has been providing provincial funding for the focus areas under social planning. So our poverty reduction report, our childcare assessment report, and our housing needs assessment.
Okay, great. Thank you. And I think we have a couple more minutes, and you had touched on this, and there was some comments on it in the question in the chat box as well. But when you talk about social cohesion, you had talked about it as kind of being that foundational piece upon which you then look at other social issues as well. There was a question there about what social cohesion is, and I'm wondering if you wanted to, you did talk a fair bit about it, but I'm wondering if there was sort of a culminating piece that you wanted to pull together on that.
I'm glad that's been asked, because social cohesion can feel a bit nebulous and people kind of wonder, what is that? But here's another way I can describe social cohesion. Social cohesion really comes into play to demonstrate how well cohesive your community is from a social perspective, and it gets tested in moments of crises. So for example, emergency situations like the heat dome we just experienced, forest fires. Is there a natural response and ability for residents to connect with each other because they already have social cohesion with one another? So they can seek each other out, they know each other by name, and they're able to connect and support each other. And that's really, I think, what social cohesion helps to demonstrate. And it's talked about also in the language of resiliency. So a community is often more healthy and resilient if they have greater social cohesion. I would argue sometimes in rural communities that's really possible because you often just naturally know who your neighbors are, and irregardless of your neighbors' values comparatively to yours, in a small town, you just kind of do connect and you get to know one another. So that social cohesion piece is really foundational to how are we doing and how do we support one another. And also our lack of social cohesion can really demonstrate for us what are the opportunities and why are we not feeling a sense of connectivity to one another, and how can we address that. I just want to make a shout out to the Vancouver Foundation's Neighborhood Small Grants program that I used to work on and still continues today. And it's these kind of small grassroots ways in where people are encouraged to connect with one another. And as soon as people know who their neighbors are by name, they will seek each other out and help each other in moments of need. So that's really social cohesion. And as I mentioned with our mill closing, it's about taking care of our residents and our people. So knowing that this has impacted a large part of our population. And as I said, doesn't just impact the workers, but their family members as well. So how do we help to take care of them and help to maintain their connectivity to our region as they transition through this as family members?
That's great. Thank you very much, Meriko, and thank you for all the questions. And we're kind of hitting the noon marker here, where we'll have to wrap up the questions for now. Thanks, everyone, and have a wonderful day. Bye for now.
Thanks again, Meriko. Thanks, everyone.